scene opens with a fast-paced montage of frustrating healthcare moments. Someone looking at their watch in a crowded waiting room, a person looking confused at a long prescription list, a doctor shrugging. Hey everyone, and welcome back to the channel. Does this look familiar? You feel unwell? You spend hours in a waiting room, only to get a prescription that might work. Or might not. You're told to try this and see. It feels like we're just throwing darts in the dark, doesn't it? We've all been there, feeling like just another number in a system that treats everyone the same. But what if I told you that in the near future, that entire experience could become a relic of the past? What if your healthcare, from the medicine you take to the diet you follow, was designed specifically for you right down to your DNA? This isn't science fiction. This is the promise of personalized medicine, and it's closer than you think. By 2035, the world of health is set to look radically different. Forget one-size-fits-all solutions. We're talking about a future where your unique genetic makeup is the key to unlocking a healthier, longer life. Stick around because today we're taking a deep dive into what your health journey will look like in 2035, and trust me, you're going to want to see this. So, how does this revolution begin? It all starts with something that's already becoming more accessible: your genome. Imagine a future where, from birth or during a routine checkup, your entire genetic code is sequenced. This isn't just a fun ancestry test, it's your personal health blueprint. This blueprint will live securely in your digital health profile, accessible to you and your doctors at the touch of a button. Think of it like this. Right now, doctors prescribe medicine based on large clinical trials. They know a drug works for, say, 60% of people. But what if you're in the 40%? That's where the trial and error comes in. With your genetic map, doctors can see exactly how your body is likely to react to a specific medication before you even take the first pill. This field is called pharmacogenomics, and it's a game changer. Let's say you have high blood pressure. Instead of trying 3 different medications over 6 months to find the right one, your doctor will scan your genetic data. Ah, they'll say. Your body has a specific enzyme variant that metabolizes drug A too quickly, making it ineffective, but drug B will be a perfect match. You get the right treatment, at the right dose, from day one. No more wasted time, no more unnecessary side effects. This means treatments become faster, safer, and dramatically more effective. This isn't just about convenience. For serious conditions like cancer or heart disease, getting the right treatment immediately can be the difference between life and death. And this goes way beyond just prescriptions. This genetic blueprint will unlock proactive, preventative healthcare like never before. Your digital health profile won't just sit there. It will be constantly analyzed by sophisticated AI. Imagine your smartwatch or a small wearable biosensor is tracking your vitals in real time, your heart rate, your blood sugar, even specific protein levels in your sweat. This data stream is fed into an AI system that knows your genetic predispositions. Let's say your genes show a slightly higher risk for developing type 2 diabetes. One morning you get a notification on your phone. It's not an alarm, it's your personal health AI. It says, "Good morning. Your inflammatory markers were a little high overnight, and your glucose response to dinner was slower than usual. I recommend a 20-minute walk this morning and maybe swapping your usual breakfast for this high-protein alternative. I've also added the recipe to your smart fridge." This is predictive health. It's about catching problems before they even become problems. The AI isn't just a nagging voice, it's your personal health coach, constantly steering you toward better choices based on your unique biology. It can suggest dietary changes, exercise routines, and even mental wellness activities tailored to what your body needs at that very moment. Forget generic advice like eat less and move more. Your advice will be, your body needs 10% more potassium today. Here are 3 delicious recipes to get it. Now, let's talk about one of the biggest frontiers: cancer treatment. The future of oncology is incredibly personal. Today, we often categorize cancer by where it is in the body: lung cancer, breast cancer, and so on. In 2035, we'll be looking at its genetic signature, a process called a liquid biopsy. A simple blood test will be able to detect tiny fragments of DNA shed by tumors, long before they would show up on a scan. Once a cancer is detected, its entire genome will be sequenced. The treatment will then be designed to attack the specific mutations driving that cancer's growth. We're already seeing the beginnings of this with immunotherapy, which trains your own immune system to fight cancer cells. By 2035, this will be hyper-personalized. We might develop a custom vaccine created just for you that teaches your T cells to recognize and destroy your specific cancer cells and nothing else. This means chemotherapy with all its brutal side effects could become a last resort rather than a first line of defense. Treatment will be more like a precision missile strike than a carpet bombing campaign, targeting the disease while leaving your healthy cells unharmed. The survival rates for many cancers could skyrocket as a result. Of course, a future this connected raises big questions about privacy and data security. Who owns your genetic data? How do we ensure it's used for your benefit and not against you by insurance companies or employers? These are critical ethical hurdles we'll need to clear. In our 2035 scenario, you are the ultimate owner of your health data. It's stored in a decentralized, encrypted digital vault. Think of it like a blockchain for your biology. You grant temporary access to your doctors or researchers for specific purposes, and that access can be revoked at any time. Strong regulations like a Genetic Information Bill of Rights would be in place to prevent discrimination based on your DNA. Building trust in the system will be just as important as building the technology itself. This future also reshapes the role of your doctor. They will transition from being a diagnostician to being your health strategist. With AI handling much of the data analysis and routine monitoring, your doctor can focus on the human element, understanding your lifestyle, your goals, and your concerns. They will be your expert guide, helping you interpret the AI's recommendations and co-creating a health plan that works for you as a whole person, not just a collection of data points. The annual physical will transform into a strategic planning session for the year ahead, optimizing your health and wellness based on real-time data and long-term genetic insights. So what does this all mean for you, living in 2035? It means you are empowered. You are no longer a passive recipient of healthcare, but the active driver of your own well-being. Your health is no longer a matter of chance, but a matter of design. You'll have the tools and information to make the best choices for your body every single day. Chronic diseases will be managed proactively, acute illnesses treated with precision, and your overall health span, the number of years you live in good health, will be significantly extended. It's a future where we don't just treat sickness, we cultivate wellness. A future where your medicine is as unique as your fingerprint. It's a fundamental shift from a one-size-fits-all model to a one-size-fits-one reality. The journey there is complex, with technological and ethical challenges to navigate, but the destination is a world with better health for everyone. What do you think? Are you excited or a little nervous about this future? Let me know your thoughts in the comments below. I'd love to hear what aspects of personalized medicine you're most looking forward to. Thanks so much for watching. If you found this glimpse into the future of health fascinating, please give this video a thumbs up, and don't forget to subscribe and hit that notification bell so you do not miss our next exploration into the technologies shaping our world. Stay curious, stay healthy, and I'll see you in the next video.